Welcome, Dr. Molloy. Thank you for being with us today.
Good morning. It's a pleasure to be able to be here with you, and I look forward to sharing some information and knowledge with your listeners.
Great. We welcome you to Health Justice Radio.
Great.
So, first I'd like to spend just a couple minutes talking about kind of the mission of the Down Syndrome Association of Toronto and what its objectives are in the community.
Well, the Down Syndrome Association was started by parents seeking support, seeking networking, and seeking a framework to ensure that their children lived a full life and that their children would be involved in activities relating to school and relating to daycare and relating to recreational activities. So they just basically felt that their children were not being treated the same as other children, and they saw that as a need to rally together. So the history is that it was a parent volunteer group who saw a need for justice, I guess, for their children. As a result, it is a volunteer charitable organization that is basically run by parent volunteers and many other generous volunteers who provide service and take their talents to projects and to events that we, as the Down Syndrome Association, organize. And basically, I guess, a chief function is to provide service to our member families and to empower our families to be able to support their children as they move through the different phases of life. And it's also to advocate for legislative changes, to advocate for better health identification by doctors in terms of how to assist and look after the health and wellness of our children as they proceed through life. And then I think it's also to ensure that we project the abilities of our children and of our members' families. In other words, I think that still, as you mentioned, society tends to look at persons with intellectual disabilities through the lens of deficits and not see them through the lens of assets. And I like to think of our kids and our young people as diverse ability. That's the topic for me, it's diverse ability. They have different abilities. And being the parent of Lindsay, I always say when people say, "Oh, you have Lindsay," and I say, "Yes, she is gifted with Down syndrome," because all of our children and all of our young people and all of our adults, they bring special talents to the world. They see things through a different lens, and it's a very positive lens. So maybe that's a bit of a kind of an overview.
Great. I really like that term that you use, gifted with Down syndrome. I know, having a sister myself with Down syndrome, I definitely feel the same way. So thank you for that. And I'd like to talk a bit about prenatal screening and diagnosis. So these involve procedures like amniocentesis and a new non-invasive DNA test that's available just in the U.S. It's called Sequenome. And these kind of procedures allow mothers to make decisions about their pregnancy. And you mentioned a fact to me earlier that statistics tell us that about 90% of women in the United States who find out they have a fetus with Down syndrome will terminate the pregnancy. And I'm wondering if we can speak a little bit about maybe some of the factors that are leading to these trends and why do you think this is happening?
Well, I think that, first of all, I think in the instance of improving communication, I think that the medical schools, for example, should certainly spend some of their time in terms of training our future doctors and maybe even in some in-service for our doctors in what constitutes health care, first of all, for Down syndrome in the post-birth era, but also when the news is delivered. I think that doctors certainly have the obligation to diagnose it correctly. They also have the obligation, of course, to inform the parents. That is what they have to do legally. But I think what we're working, or I guess what we find is it's the method of, first of all, when the baby is born, it's the method of delivering the news. I think that it's important that that's a very traumatic moment. And therefore, while we're giving the news, I think it's how we give the news and the sensitivity. this would also go to when the diagnosis through amniocentesis, for example, is that, by the way, you have a child, you're carrying a child with trisomy 21, then I think that it's important that the cessation of the pregnancy is one option that needs to be presented, okay? But then we also need to look at the other option, because sometimes if you only get one point of view and it's maybe not delivered sensitively or carefully, and you believe, I guess, as an expectant mom that your life is over or it's going to be terrible. And in some cases, many moms maybe do it because they think maybe for the benefit of their child, they don't want their child to have maybe less of a full life. So I think that there's a lot of emotions there in terms of the information. I know for myself that when we were, talked about, an amniocentesis test with our doctor when my wife was pregnant with Lindsay, we asked a question, why? What's the purpose of it? And it was to determine the gender. And I said, well, that's irrelevant to us. We don't need to know, months in advance. And the second reason was if there's any sort of medical concern. And I said, well, that wouldn't be one for us. Now, in our case, the doctor knew that he had to present that because that's part of his or her legal obligation. But they also knew us in terms of our personal beliefs and values. That would not have been an option. So that's not a criticism to the people who decide that the pregnancy needs to be terminated. I think we need to understand that, I guess what we always want to understand is there's all sorts of reasons, and it's not just a simple matter of that, because I am, certain that when women make that decision, it is very traumatic for them, that they go through a lot of anguish and do not make it without a lot of pain. So therefore, we need to understand that motherhood, being Mother's Day tomorrow, that motherhood has a special bond that only moms can have because they bear the baby in their womb for the 9 months. So it's just that I would like moms to be able to see what I have had, and that's the joy of having my daughter in our lives. I cannot imagine our life without Lindsay, because it is just filled to the brim, and I think that would be the same for all of us parents. So I think I would just like to ensure that when moms are thinking about that at least is part of the conversation, and then they're going to make the decision based on their own circumstances, and I trust that they will make the decision that they think is in the best interest of their child.
So what do you think is kind of leading to this lack of knowledge or information provided by the healthcare providers? Do you think it's a lack of education, exposure?
Well, I think that, for example, in terms of GPs, general practitioners in Toronto, we don't have, first of all, in Toronto, any sort of a doctor who has kind of like maybe a clinic or maybe even as a GP taken on a specialty with Down syndrome. We have good practitioners who basically we as parents trust, and therefore we know that they will be kind and they will do their best. But I think in fairness to the practitioners, they have so many things that they have to be up on, an expert on, that we can't expect them to know everything. So I think in my case, Down syndrome, we provide the doctor with some of the things, for example, that he needed to monitor on Lindsay, and I think that that's fairness, because I think we have to help our medical practitioners with knowledge that we have, because we live with the child, and I think we know certain things, whereas they deal with patients of all different age groups and so on. So I think that the idea of the education, for example, I think it's important. For example, if I was in charge of the medical college, I would certainly have an opportunity for a parent group, an organization such as ours, to go in and maybe have a little part of their session on the whole idea of delivering the news and the sensitivity, but also to acquaint them of some of the challenges for parents, how parents have to work through all sorts of concerns, because there's no one-size-fits-all with Down syndrome, I say. If you have diagnosed or met one person with Down syndrome, then you have met one person with Down syndrome. I think we tend to kind of commodify them and say, oh, well, I think this is what it is, because while there are certain commonalities,